So for today's sessions, we will be doing diet in gastrointestinal diseases. It's chapter 17, page number 361. Those who have the old textbook, page number 361. Those who have the new textbook, please mention the page number in the chat box. Diet in GI diseases, chapter 17. And please stay back at the end of the class. We'll discuss on some legal details of working as a freelancer after completing this course. Regarding your registration and working as a freelancer, we'll have a small discussion and also a chance to upgrade to postgraduate diploma. We'll discuss about that as well at the end of the class. So please stay till the end of the session. So if anyone is joining late, please help them out with the page number or the topic name. Diet in GI diseases. So your gastrointestinal system that starts from your mouth and it ends at your anus. It's a single tract. Okay, it's a single tract. It's a one-way. It's a one-way source of food going in and you excreting it out of your anus. Okay, so from the mouth till the anus, it's just a single tract. That is the GI tract, gastrointestinal tract. Okay, so a lot of diseases do take place at different areas of the GI tract. Okay, the most common one we'll discuss here in this topic. Not all the GI diseases have been mentioned that in the textbook. Also, in some of our Wednesday classes, we are taking GI diseases. Okay, not the diet part of it, but just to make you understand the different types of GI diseases. Okay, the most common one with their slight management. Okay, how can you manage it? Will basic management we'll discuss here, not the clinical management, not the surgical management. Okay, no pharmaceutical management will be focused more because those management has to be taken up by a gastrointestinal doctor. Okay, or gastroendocrine disorder specialist. They will be taking up the clinical part of it. Either it could be pharmaceutical, medical, surgical. Those management will be done in the hospitals by specialist. Okay, whatever dietary changes we can do in certain diseases, we'll discuss in this chapter. Okay, and questions pertaining to only the dietary management will come in examination, not the clinical part. Okay, please keep that in mind. So first condition is GERD, gastroesophageal reflux disease. Okay, so you can see here on the left side is a normal stomach. This is the esophagus, your food pipe, and from here the stomach starts. The end of the esophageal sphincter, from there onwards the stomach starts. Okay, so normally you can see here this closed sphincter. Okay, it has to remain closed so that the content in the stomach should not go up. Okay, because when you have hiccups, when you wear some tight clothes, okay, when you are your stomach is completely full and you do some exercises, you jump. Okay, there are some chances that certain contents of the stomach can spill back into the esophagus. To prevent that, this sphincter will remain closed. Okay, when the food is entering from the esophagus, that's when this opens. When the food falls into the stomach, this will close. Okay, so it is an automatic process. But when GERD happens, the sphincter remains partially open. It is not completely closed. Something wrong happens with the anatomy of the sphincter. It is partially open, or sometimes it is completely open. And what happens is that the contents of the stomach can easily spill into your esophagus. Okay, and definitely the content of the stomach, one major component of it is hydrochloric acid. Okay, the presence of hydrochloric acid you cannot feel because the stomach has a thick mucus lining which prevents the hydrochloric acid from burning the stomach tissue. because stomach has that specific lining, but your esophagus doesn't have that lining. Okay, the esophagus does not have that thick mucus specific lining, some specific epithelial cells that the stomach has. Esophagus does not have that. So what happens? Even little bit of the contents mixed with the hydrochloric acid, if it spills into the esophagus, you will feel the burn. You will feel the burning sensation of acid reacting with the healthy tissues, the soft, delicate tissues of the esophagus. That's what you call as heartburn or acidity. Is it clear to all? How do you feel the acidity? Why does acidity happen, or why does heartburns happen? So this is GERD, gastroesophageal reflux. Reflux means going back. Contents are going back into the esophagus disease. Okay. So there are a lot of causes that could lead to GERD. If you have a poor diet, okay, lots of sugar, lots of fat, lots of soft drinks, lots of processed food, these can also cause you GERD. Eating late at night, and when you eat late at night, you're overindulging yourself, eating a full stomach of meal and immediately going to sleep. Okay, not having a proper food schedule, not eating food on time, not having a proper food schedule, having a lot of stress, anxiety. Okay, and long hours of starvation, fasting for too long, and then when you break your fast, you eat a lot of oily food in that will also lead to GERD. Smoking, alcoholism, okay, these can also lead to GERD. Okay, so lifestyle changes that you can do to treat GERD. If you are a smoker, or if you struggle with alcoholism, you have to quit it. Okay, any substance abuse, you have to quit it. You have to exercise regularly. Sit up straight, don't slouch. Okay, sit up straight, especially while having food, and after having food, sit up or walk for it or for a while. Okay, it's very good to walk for 10 to 15 minutes soon after you have food. Okay, it also activates your cells to consume, to react to insulin and take up the glucose. Okay, so you will not feel insulin resistance. And eat small meals throughout the day. Don't like, even if you have 2 meals a day, make sure you have some snacking time in between. Okay, so that the entire calorie load is not dumped into the two specific meals. Okay, chew the food slowly. Avoid food that triggers heartburn, like too much of sugary, oily, spicy food. Okay, wear loose, comfortable clothes. People who wear tight clothes, especially women who wear body shapers and all, tummy tuckers, body shapers, they suffer from a lot of heartburn. Okay, sleep with your head and shoulders propped up, and reduce your caffeine intake. If it is over 2 cups of coffee or tea a day is completely fine, not more than that. And avoid lying down for at least 3 hours after meal. So try to sit upright or walk for 10 to 15 minutes, then make sure you sit upright. You don't lie over, or you don't slouch. Okay, so these things can prevent GERD. The next condition is indigestion. Okay, indigestion, another name is dyspepsia. Not able to, the stomach is not able to churn food properly. Okay, and you will have a lot of discomfort, difficulty in digesting food, and you will feel some uneasy sensation. Sometimes there is gas as well, bloating as well. Okay, and the causes of indigestion could be either some emotional tension, you are stressed, malnutrition. Okay, any infection, eating too much in a very small span of time. Okay, not eating properly, not chewing properly, especially if it is some legumes, pulses. Okay, like Bengal gram, chana dal, kabuli chana, okay, legumes like rajmas and all. Okay, if you're not chewing it properly, or if it is undercooked and you're not chewing it properly and gulping it down, okay, that could also lead to indigestion. And indigestion alone, it is not a disease condition. A lot of gastric issues, in a lot of gastric issues, you will see indigestion as a symptom. Okay, indigestion as a whole, it's not a disease condition, but you will see this as a symptom for many other chronic or acute gastrointestinal diseases. Okay. And other disorders in which indigestion is commonly seen is if you suffer from atherosclerosis, high BP, any liver diseases, renal diseases. Okay. And the symptoms of indigestion, you will have abdominal pain, bloating, nausea, regurgitation, and belching. Belching is burping. Okay. Frequently, you are burping. Gastritis, peptic ulcer, lactose intolerance, okay, delayed gastric emptying, food is staying in the stomach for a pretty long time, any gallbladder diseases, any gastric or colon cancers, this can lead to indigestion. And if you indulge in taking too much of food in a very small time, which is high in fat, sugar, caffeine, too much of spicy food at once, okay, alcohol. So when these food are taken in a very short time, within 10-15 minutes, you have completed a whole plate of biryani. Okay, for example, these can lead to indigestion. So diet restriction is one of the way you can treat the patients. You have to make sure they fast a little bit. They eat a lot of raw food, okay, like salads for a time being. They'll eat a lot of less spicy food, bland food for a time being to tackle indigestion. Make sure that they're eating slowly, chewing the food thoroughly, eating at a proper scheduled time, and they're relaxed while they're eating, not stress eating. Small frequent meals, and avoiding gas forming food or any food that causes intolerance or food sensitivity. Avoiding those foods is a way how you manage indigestion. Is it clear to all about indigestion? Indigestion as a whole, it's not a disease condition, but it's kind of a symptom very commonly seen in various disease conditions. Okay, so the management technique is the same for all. Next is peptic ulcer or stomach ulcer. Okay, so what is an ulcer? It's a wound. Okay, and what is a wound? It's an abrupt opening in the smooth surface of the skin. Okay, or any smooth surface where there is an abrupt opening that exposes the cells beneath it or tissues beneath it is called a wound. Okay, and ulcer is a wound. Okay, ulcer that happens in uh, uh, to a mucous membrane. Okay, a wound that happens interiorly on a mucous membrane is usually we call it as ulcer. Okay, and it's caused by any erosion. The cells in this wounded area erode, they vanish away day by day, okay, of the mucous lining of any part of the alimentary tract or gastric tract, especially those that come in that is frequently in contact with the gastric juice, because gastric juice has hydrochloric acid, okay, which if the concentration of the hydrochloric acid is high, it will cause erosion. Okay, it will cause erosion it in weaker parts of the stomach. Okay, the weaker parts of the stomach will undergo erosion, and that's where ulcer is formed. And the majority of the ulcer you see in peptic ulcer cases are found in duodenum. This is the duodenum, the C-shaped part you see when the stomach ends. Okay, the stomach ends here. And from here, the C shape that you see, that is the duodenum. This entire C shape is a duodenum, first part of your small intestine. So majority of the peptic ulcer forms near the duodenum. And it can happen in your esophagus as well, within your stomach, or sometimes at the jejunum part also. Jejunum is the second part of your intestine. So causes of peptic ulcer, either you are using a lot of steroid medications, okay, anti-inflammatory medications, steroids, or you are on steroids for a very long time. You have H. pylori infection, Helicobacter pylori. That's a bacteria. H. pylori is a bacteria, Helicobacter pylori. They cause peptic ulcer. Too much of secretion of hydrochloric acid, overactive glands that secrete hydrochloric acid could also be a reason of peptic ulcer. So pathways, the way how peptic ulcer is formed is majorly these three causes. And sometimes if the mucus layer within the lining of the stomach is not secreting enough mucus, okay, that can also trigger peptic ulcer, because you are not having enough lubrication inside the stomach. You don't have enough waterproofing inside the stomach. That could lead to peptic ulcer. So signs and symptoms of peptic ulcer: you will have epigastric pain, that is upper part of the stomach, not the lower part, just near your rib cage. You know where your rib cage ends, okay, that part you can call as an epigastric region, okay. So that is the upper abdomen, upper part of the just where your chest ends, the thoracic cavity ends, and the abdominal cavity begins, the end part of your rib cage, okay. So this is where you will find major pain, burning sensation, epigastric pain, heartburn, okay. And usually um, 1 to 2 or 3 hours soon after you have meal, that's when you find this pain happening, okay. And it could be a piercing, burning pain. And as soon as you take some alkaline supplement, okay, antacid or alkaline supplement like milk of magnesia, any antacid medication you are taking for acidity, as soon as you take it, you feel the relief, okay. Blotting will be there, and blotting can lead to more flatulence as well, okay. Flatulence is fart, okay. The stomach will stay distended for a long period of time. Protein levels in your blood will be lower than normal. You will suffer from weight loss, iron deficiency, anemia. These things are common because, as we have seen in the previous class, okay, there are parietal cells in the stomach, okay. Parietal cells, they secrete intrinsic factor and hydrochloric acid, okay. So when these cells are destroyed because of peptic ulcer, erosion of the cells in the stomach, okay, there is no enough hydrochloric acid, there is no enough intrinsic factor, that could lead to iron deficiency anemia and megaloblastic anemia as well, pernicious anemia as well, okay. Some hemorrhage could be, there is a wound inside the stomach, means it may bleed. In severe cases of peptic ulcer, this ulcer will start bleeding, and the blood, when it mixed with food, blood that is bleeding from the ulcer, when you eat food, this blood will get mixed with the food. It will go through the duodenum, in the intestine, large intestine, and it will take its own pace. The food will have its own pace to exit the body, but in the meanwhile, the blood will clot as well. the blood will undergo clotting. That is the reason why you get dark stools. Okay, when you defecate, when you pass, when you excrete, the stool color is very dark. That is one of the reason, that is one of the symptom that indicates you may be having peptic ulcer, and that is bleeding peptic ulcer. Okay, the peptic ulcer which is hemorrhagic, which is bleeding. Okay, that leads to uh, dark stools because the blood has clotted. Okay, nausea, vomiting, unexplained weight loss, heartburn, bloating, these are the symptoms of peptic ulcer. And sometimes when you vomit, even in your vomit you will find blood. Okay, how do you diagnose a peptic ulcer or duodenal ulcer? You can do endoscopy. You insert a fiber optic tube through your mouth. Okay, it visualizes the insides of your GI tract, and it can find exactly where you have the ulcer, the size of the ulcer. Is it a bleeding ulcer? Okay, the grade of the ulcer can be found out with endoscopy. Biopsy can be done. A part of the ulcer can be taken to see if it is cancerous or not. Stool examination can be done. If it is dark tarry stools, you can find if it is blood clot or is it something else. Blood examination can be done to find out, do you have low levels of plasma protein or not. Urea breath test is done. So here a urea a carbon isotope, okay, is given to the patient to swallow. When the patient will swallow it, and after some time, for 10-15 minutes, the patient is asked to uh, blow into a tube. Okay, and the color, if the color changes of the in the tube, it means there was urea in the breath, which means there is a presence of Helicobacter pylori in their stomach, because these Helicobacter pylori, they will use up the carbon isotopes and they will excrete urea into the air. Okay, so if the air has that urea, so there is a color change in the air that you are blowing out. Okay, and which will determine that there is urea in your breath, which means you have Helicobacter pylori in your stomach. Okay, upper GI barium study, again barium meal is given. Flavored barium you will swallow, and this barium will line the entire GI tract, and it is radio opaque. Okay, when you see yourself in X-ray, barium will not allow X-ray rays to pass through it. Okay, so wherever the ulcer is, the barium will definitely coat that area also. Okay, so with that X-ray, you can find out which all part of the body is affected with ulcer, how many ulcers you have. Okay, that is barium study. CTs can also be done to diagnose the extent of ulcers. So treatment, these are the medications given. You can take a screenshot of it. Not much questions will come from here. Okay, so major medications given here is the reduction of gastric acid secretion. So antacids are given. Okay, Rantac, ranitidine, omeprazole, pantoprazole. Omeprazole can also effectively reduce your nausea and vomiting as well. If the patient is suffering from H. pylori, okay, it's a bacteria, so antibiotic can be prescribed like amoxicillin. So doctors usually prescribe this. Ulcer protectives can be given, that is sucralfate, that will make sure that the ulcer that is already present is not getting worsened. Okay, ulcer healing drugs can be given. Prostaglandins can be given. Prostaglandins should be produced in the body, but if your body is not able to produce adequate amount of prostaglandin because you're not having enough amount of omega-3 fatty acid, so prostaglandin substitutes can be given. Coming to the dietary management of peptic ulcer, total nutrition has to be maintained. Make sure that the patient, even though the patient is suffering from peptic ulcer, the patient is not malnourished, okay, doesn't undergo malnourishment. Protein rich food is given because the more you have protein, it will help with wound healing. Okay. Protein breakdown is one of the cause that the blood plasma protein level is falling, which means the protein in the blood plasma is taken up by your own body to heal the ulcers as much as possible. Okay, so give them a protein rich food so that it can help in wound healing. Since ulcers are also wound, you want to heal it from within. Okay, so more protein is required. Fat should be in moderation. Carotenoid rich food, because beta carotenoids are good antioxidants and they are toxic to Helicobacter pylori if you suffer from a peptic ulcer caused by this bacteria. Okay, carotenoid rich food is toxic to these bacteria. They can inhibit the growth of Helicobacter pylori. Ascorbic acid, that is vitamin C, again, it helps in wound healing. And again, it is also an antioxidant that can prevent H. pylori infection or suppress H. pylori infection. But the main reason of taking vitamin C should be for wound healing. So citrus fruit juice and tomato juice, these things can be given. pH of the food does not have any significance. Okay, whatever food you eat, okay, whatever acidic food you eat, you can be very well assured that the stomach acid that you have, hydrochloric acid that you have, okay, it will definitely have a very high pH as compared to any other acidic food that you eat. Okay, so pH of the food that you eat has no significance here. So there is no food in the world present, no acidic food that can change the acidity level of your stomach. Okay. If you have B12 deficiency, if you're an alcohol addict, B12 deficiency has to be corrected. Gas formers, especially flavored food like cabbage, cauliflower, onions, fried food, turnips, okay, they can cause more gas in the system. That has to be restricted. Large meals are avoided. More fiber intake is considered good and it is beneficial as well. Avoid irritants like pickles, spices, alcohol, smoking, caffeine, mint, aspirin. Aspirin is a NSAID, okay. Nicotine, garam masala, meat soup, strong tea, strong coffee. Okay, these things has to be ginger as well, ginger, chilies, pepper. Okay, this has to be avoided. Proper rest should be given because stress can also aggravate your peptic ulcer. So learn to manage stress. Mental and physical rest is important. Quitting alcohol and smoking, if that behavior is present, it has to be quit. Foods that you can take in peptic ulcer cases are like you can take milk, cream, butter, dairy products can be taken if you're not lactose intolerant. Boiled egg, steamed fish, rice, puffed rice, cereals, rava. all green leafy vegetables, custards, malted drinks. Malted drinks means when you take like any millet or any cereal, you sprout it, you sun dry it, then you grind it into a fine flour. Okay, that's what you call as malt. Usually you give malted drinks for growing children. It's a good source of protein. Pulses that are not gas forming, those pulses can be given. Highly processed food has to be avoided. This condition can be managed with diet, medication. Any laparoscopic surgery can also fix it. You will not require an open stomach surgery for peptic ulcer nowadays. Laparoscopically, you can fix the wound. Clinically, you can manage it. Clinical management, medication management is more than enough. Rarely you will require an invasive surgery for peptic ulcer these days. Okay. Is it clear to all regarding the management of peptic ulcer? Next is gastric surgery. Any hemorrhage, perforation, or obstruction that happens at any part of your GI tract, okay, usually a surgery could be advised. Okay, after any type of gastric surgery, for a time being, oral intake of food or any fluid will be suspended because you want your GI tract to heal. Okay, if your GI tract is okay, it can digest. Okay, it can function. There is no requirement for enteral or parenteral feeding. If your GI system is working, you have to use it. That is the motto. If the GI system is working, if the GI tract is working, use it. That is the motto. But if it is not working, a surgery has been done, wound healing has to be achieved. Okay, so for the time being, we will have to suspend any oral intake of food. Okay, so what else do we have? What other options do we have? So once the function is regained, liquid diet will be started, and slowly over a period of time, liquid will transform into semi-liquid, semi-solid, and solid food. Okay, so step by step, it's a step-by-step process. But until the oral feeding is regained, the patient will be fed through any tube, enteral feeding, okay, or through parenteral feeding, that is through that blood vessels. Okay, so you have one option of NG tube feeding through your nostril. NG means nasogastric tube. From the nasal cavity, a tube will be inserted. It will end till your stomach. In some cases, it can end till the duodenum. In some cases, till the uh, jejunum as well, depending on the case. Okay, so this feeding tube will be placed in the stomach. So whatever feed that you give without touching the oral cavity, without touching the esophagus, it directly enters the stomach. Okay, that is NG tube feeding. And some other options you have if the patient has oral cancer or the patient's jaw has been removed. In such cases also, you can't putting an NG tube is also risky. Okay, there is a high chance of tube dislodgement. Okay, so in that case, a gastrostomy or a jejunostomy is done. In gastrostomy, ostomy means you make an opening. Okay, so in a gastrostomy, you make an opening through your abdomen, a laparoscopic opening through the abdomen. A gastro tube is placed directly into the stomach, and the food is given from this G tube. Okay. In second case, jejunostomy. Again, ostomy means opening. Again, opening is made in the lower abdomen, directly above the jejunum, and the J tube is placed directly into the jejunum. Okay. Usually water can be given, and if the patient's mouth is drying up, you can give ice so that the mouth stays hydrated. Highly spiced food, fatty food, hypertonic food is avoided in tube feeding. Small and frequent feeding is given, that is better tolerated than a large. You are not supposed to dump the fluid. Okay, nurses have to be very careful while dealing with a tube feeding patient. In some cases, just because they don't want to frequently feed the patient, they may dump a lot of food together in the tube. Okay, that should not be done. It could lead to tube distortion and dumping syndrome in the patient. That has to be avoided. Okay, so frequent meals through these tubes are given, and that is also under prescription. How much ml at what interval has to be given, the doctor will prescribe it. Okay. Is it clear to all regarding gastric surgery and tube feeding? Next is dumping syndrome. So dumping syndrome I have just recently mentioned, and it is usually seen in patients who have undergone a gastric bypass surgery, okay, or people who suffer from uh, any central nervous system disorders in which ghrelin or leptin hormone is not secreted properly. So you do not know when to stop eating. Okay. In a given small period of time, you eat a lot of food which is high in carbohydrates, it has a lot of liquid content in it, high in fat. Okay, within few minutes you completely dump it down into your system. That could lead to dumping syndrome. Okay, so it's a very complex physiological response that happens when larger than normal amounts of food or and liquid together is taken. Okay, this is one of the reason why it can happen to anyone. Some people are more prone to it. So this is the reason why it's said that don't drink huge amounts of water when you're eating food. Okay, you can drink at least 5 minutes before or 5 minutes after, 5 to 10 minutes after having food, or 5 to 10 minutes before having food. And while having food, sipping small quantities of water, okay, under 75 ml is fine, but not more than that. Okay, because that could lead to dumping syndrome. Okay, so what happens is when this large amount of food enters your stomach, okay, your stomach can't take it. Without properly digesting it, the stomach will dump it all into the duodenum, and from the duodenum it will be dumped into the, it will be moved forward into the small intestine without proper time taken by the stomach to churn the food. Okay, to work with the food, to work with the enzymes and hydrochloric acid, the stomach will directly dump it into the duodenum. That's why we call it dumping syndrome. Stomach can't take it, stomach can't hold it anymore. Okay, the stomach is out of capacity. It will dump this huge amount of food into the duodenum. Okay, so within 15 to 30 minutes after eating, this can take place. The person may feel weakness, dizziness. Okay, when they eat a lot of food, they will go into a stage of vertigo. They will lose their consciousness, lose balance, tachycardia, their heart rate will increase. They will have severe stomach pain. Okay, and some cases within half an hour of having this large food, they have to rush to the bathroom. Okay, because even the intestine can't deal with such huge amount of food. So the intestine will, without digesting it, will try to push it out of the system. Okay, so within half an hour, within 20 minutes, the people will run to the bathroom to defecate. Okay, and there is an epigastric fullness, and that would lead to breathlessness. You will not able to breathe properly because the stomach is so full. Okay. So that is dumping syndrome. So to prevent it, you have to make sure that people who are prone to having this dumping syndrome, they have to make sure that they take very small meals, at least 6 meals throughout the day. They have to take very small 6 meals. Fluid intake during meal should be completely restricted. In no way you will drink water 20 to 30 minutes before or after food. Okay, or any kind of fluid, not just water, juice, smoothies, buttermilk, okay, soup. These things has to be restricted while having food. At least half an hour after meal, you have to restrict drinking any liquids. Complex carbohydrates has to be given, which are not easy to digest. Fresh fruits, vegetables, these are preferred. Simple carbohydrates like sugar, candies, sodas, sweets, desserts, avoid them. Any dairy product is also not that well tolerated in majority of the cases, so avoid it. Protein intake, fat intake should be increased so that you can meet your daily caloric needs. And to make sure that you don't suffer from high BP, make sure the patient lies in a supine position for 30 minutes after meals to delay the gastric emptying. This is just the opposite of um, GERD. Okay. So here, when the patient lies down, because of gravity, the food will not move downward. Okay. In the supine position means lying up, like how you sleep, your face up, you lie on your back. Okay. Soon after having food, you have to lie down so that you are slowing down. Okay, by not allowing gravity to pull the food downwards into your small intestine from the stomach. When you lie down, the food will remain in the stomach for a longer period of time. Okay, so just what you do in your GERD, just the opposite of it you have to do here in dumping syndrome. And you can take fiber supplementation as well. Okay, isabgol can be taken, any brand, cellulose. 5 grams of pectin with any meal can be taken. Taking yogurt will be fine because yogurt has a very thick consistency. It does not have a runny consistency. As compared to curd, yogurt has a more creamier and thick consistency. Is it clear to all regarding dumping syndrome? So these are dietary modification done in dumping syndrome. Small meals, at least 6 meals. Divide the 2 meals or 3 meals into 6 meals a day. High fiber, high protein meals. Take dietary supplements. Okay, because there are high chances that your intestine is not functioning normally, so absorption will be at stake. Nutritional absorption will be at stake. So take dietary supplements. Okay, take fiber supplements as well. Pharmacological interventions like acarbose can be done. Okay, stomato, these are the medications. My acarbose and all is used in diabetes control and all. Okay, consider antiemetics. Antiemetics means that prevents vomiting, nausea and vomiting. Antidiarrheals that will prevent diarrhea. Okay, because diarrhea and vomiting is very common in dumping syndrome. Okay, Some invasive interventions can be taken, like gastric bypass reversal. As I mentioned, through all the patients who undergo gastric bypass, what's happening here is you are reducing the size of the stomach. Okay, so the function of the stomach is also reduced. And by mistake, if you have a little bit more than what is prescribed to you, the stomach will dump everything into the duodenum. Okay, so that's a complication of gastric bypass surgery. You may have to reverse it. Okay, gastric pouch restriction has to be done, pancreatic resection has to be done. So these are the invasive interventions which any gastric bypass surgeries, these surgical interventions are done. It may have to be reversed. Okay, to prevent dumping syndrome. You can see the symptoms here why postprandial hypertension is happening. The patient is suffering from tachycardia. When your heartbeats increase, tachycardia means heartbeats are increasing. Automatically, it will have an effect on your blood pressure as well. Okay. So soon after you have food, postprandial means after food. Soon after you have food, your heartbeat is increasing. With that, your blood pressure is also increasing. Okay, that's how you get postprandial hypertension. Is it clear to all regarding the management of dumping syndrome? Next is constipation. So there are different types of constipation. Basically, constipation, we don't call it as a disease. Constipation is a symptom to any underlying disease that you have in your GI system. Okay. So what is constipation? When you are passing firm, hard, small, rounded pellet-like stools. When you defecate, okay, the feces is very hard, very firm, small, round, marble-like, pellet-sized stools that are infrequent, not according to your bowel schedule, and it takes you a long period of time to defecate. Okay, so that is what we call as constipation. And there are two types of constipation: atonic constipation and spastic constipation. So here you can see the other name for atonic constipation is lazy bowel syndrome. Okay. Here the muscle tone, intestine should have a muscle tone. Okay, because of which peristalsis is taking place. Peristalsis means what? Contraction and relaxation of your intestine. Okay. And because of this contraction and relaxation, food is propelled forward. Okay, the area which has the food will contract, will squeeze, the food will move forward. Okay, because the area just in front of the contracted place, contracted tube is relaxing, so it has more space to accommodate the food. So because of this push and pull that happens, that is the peristalsis movement. Okay, only if you have a good muscle tone in your intestine, large intestine, this smooth flow of peristalsis movement will be retained. If you lack tone, muscle tone in your intestine, which means atonic, lack of muscle tone, the muscle is not toned, atonic constipation. Okay, and this is, you can see here how the normal intestine looks like and how atonic constipation, in how the large intestine folds into each other because it is not able to maintain its tone, how the large intestine folds into one single coil. Okay, so this is how this, in this case, atonic constipation happens. Okay, what are the causes of it? You are not drinking enough water or fluids. You don't have enough fiber. Roughage means fiber in your diet. not having enough potassium in your diet, vitamin B deficiency, irregular habit of not having food on time, you're not having a proper schedule of eating food, not having a proper schedule of emptying your bowels, that is defecation. And purgation is kind of a disease, not a disease, it's kind of a behavioral disease in which you eat food and you use a lot of laxatives, okay, to push the food out of your body as a part of anorexia nervosa, bulimia nervosa. People who suffer from the eating disorders, they do this purgation, okay. To take the food whatever they have eaten, to evacuate it out of the bowels, okay, by abusing, overusing and abusing laxatives, okay. So overusing laxatives or abusing laxatives for weight loss means if you eat food, you eat a lot of laxatives without proper absorption, the food will be discarded out of your body, okay. So you think that you will be losing weight, you will not gain weight by having food, okay. So this is kind of a psychological uh, behavior seen in bulimia nervosa and anorexia nervosa, okay. So that could lead to constipation, atonic constipation. Overuse of laxatives can lead to your intestine losing its muscle tone. Lack of exercise, any chronic illness, pregnancy, overusing enema as well. Overusing enema could also lead to atonic constipation. Then you have spastic constipation. So here, this is a normal large intestine, you can see. In spastic constipation, some parts of your large intestine is narrowed. Okay, it has become very thin. It is constrictive. Okay, it has undergone stenosis. Okay, it does not have enough space. So some parts of your large intestine can undergo narrowing. Okay, that's how you get spastic constipation. Okay, so the movement of the feces through your large intestine will be restricted, or it may get obstructed in the narrowed or stenosis part, okay. So proper evacuation of the feces is not done, okay. So slow transit constipation, slowly it moves up the intestine. Pelvic floor dyssynergia, which means the pelvic muscles, okay, pelvic muscles are not supporting the defecation. Irritable bowel syndrome, IBS, we will see later. Normal transit constipation, these are the primary causes. The secondary causes of spastic is anatomical obstruction. Sometimes you may have a tumor somewhere here that could cause obstruction. Some specific medication that could cause stenosis. Again, laxatives also, overusing laxatives can also cause this stenosis. Any metabolic disorders, neurologic or myopathic disorders, the nerves of the intestine here may be damaged. That's the reason why it's in a contracted state. It is not able to relax because the nerve endings here are damaged. People who suffer from depression, anxiety, somatization, they can also suffer from this same disease condition. And in some cases, it is idiopathic. Idiopathic means you don't know exactly why it happened. The cause is unknown. Idiopathic means the cause is unknown. Okay. So these are the reasons why spastic constipation can take place. Okay. Again, if your diet is not adequate, you don't have a good physically active lifestyle, okay, not able to eat on time, rest on time, eliminate on time, no schedule at all, not having enough fluid, water, fiber intake, same like atonic constipation. The reasons are here. When you have the urge to defecate, okay, early morning or whenever throughout the day, whenever you have the urge to defecate, you are not able to go. Either you're in your office, you're traveling, or you are suppressing your urge to defecate. You feel like defecating, but you suppress your urge to defecate. That could lead to spastic constipation. Slow transit constipation means the movement itself is slow. Okay. You have stenosis or you do not have stenosis, doesn't matter. The movement of food in the large intestine is very slow. So automatically you will have constipation. Normal transit constipation means the movement of the food in other areas of the intestine is normal. But as soon as it reaches the area where narrowing of the intestine has taken place, it stops there. Okay. That is normal transit constipation. Having piles, hemorrhoids, fissures can also lead to this spastic constipation. Poor muscle tone, diverticulosis, any neoplasm, cancer, tumor can also lead to that. If you're having a lot of painkillers, analgesics, uh, abusing aspirin, any anti-inflammatory agents, antacids, antidepressants, taking too much of diuretics, too much of iron supplements, taking opium, sedatives, okay, these medications can also lead to spastic constipation. Management: try to eat as much as whole grains as possible. Fruits and vegetables like oranges along with its fiber, okay, peeled oranges but with the fiber, apples with peel, carrots, cabbages, okay, these are really good for constipation. Coarse bran, you can get coarse bran separately and you can add this 2 to 3 teaspoon of coarse bran into your uh, wheat flour, okay, rice flour, whatever flour you use to make your chapatis, okay, ragi flour, you can mix it and use it in your food. Dry maize, that is corn, Bengal gram, onions, quinoa, beans, guava, okay, taking this, these are easily available, okay. Leaves, drumstick leaves, tamarind leaves, curry leaves can cure constipation. Taking hot water instead of cold water, switch to hot water, switch to ajwain water or jeera water or just plain hot water with a squeeze of lemon on empty stomach. Okay, that can also make sure that, because squeeze of lemon, if you have iron rich food, all the iron will be taken up by your intestine, okay, absorbed by the intestine without causing constipation. Laxatives only when it is prescribed. Don't self-prescribe laxatives. Don't abuse laxatives. Only if it is prescribed, use laxatives. For some people, caffeine helps. Okay, it is very genetic. So for some people, when they have tea or coffee, only then they can they can defecate. Okay, this is very genetic. There are certain genes that you may have inherited. Okay, because of this, you need your caffeine. You need either tea or coffee, and after that, you will have to rush to the bathroom. This is genetic in nature, and it's not problematic at all. Whatever helps you to defecate on time on a proper schedule is good for your health. Okay. Is it clear to all regarding the management? So uh, coming to this website, LegalWise website, please note it. Okay. LegalWise website. You can take a screenshot or you can contact me on my WhatsApp number. So LegalWise website, it provides you legal and registration services for people who are from the healthcare background, and also students who are practicing nutrition and dietetics after completing these courses. Okay, you can also seek the help of this LegalWise website. Okay, it is for NHCA students. There is a lot of benefits from this website. If you try to access this website, the fees used for your consultation and all, it's kind of either free or it is subsidized. There are some benefits to it. For legal support and registration, even if you want to practice as a freelancer, okay, and if you want to be an entrepreneur who is starting their nutrition or holistic diet coach practice, okay, that is also an entrepreneurship opportunity, either online or offline. If you're doing your freelance services, any form of healthcare or nutrition based freelance services, from start, how to establish your business, what licenses you should have, what registrations you should have, and how to get a clientele. Okay, till that end-to-end solution is given by LegalWise website. Okay, all NHCS students will have special benefits if you are joining LegalWise. Okay, even if it is a small business in healthcare. Okay, if you want to trademark something, if you want to get a copyright of your diet plan, okay, any legal notice if you want to send to somebody who is using who is unauthorized and who are using, if sometimes it happens, you are giving support to your client, but your client may be who is not from a medical background, who is not from a nutrition background, does not have any dietary practice at all, but they are selling your diet plan. Okay, so this is an unauthorized practice. These things do happen. Okay, you have given a diet plan for your client, but your client is misusing that for their family members or selling it to their friends for other for monetary benefits or some other benefits. So in these cases, if you get to know, you can send them a legal notice through LegalWise. They will give you the consultation as well. Certification, any licenses, getting a company bank account so that your taxation can be easy. Okay, you can save money on taxation as well. Okay, registration, licenses, etc. These things, the support for these things, which is very necessary once you complete the course and once you set on your practice. Some people are doing the course for their own benefit, for their own family benefit. For them, it will not be of such an issue, but if you are setting up a freelance clinic and all, you will require a proper guidance. Okay, so make sure you use this website for your legal endeavors. Once you complete the course, you can register on this website now as well, and once you complete the course, you can get the benefit of it. And also medical legal safeguards is also given to doctors who are going to practice as a nutritionist and dietitians. Okay, client documents, receipts that you have to maintain. Okay, medical legal safeguards that you should take as a precaution. So that's about LegalWise. Is it clear to all? If you have any further queries regarding LegalWise, please ask Dr. Mittal sir. Okay, because once you're setting up your own practice and your own freelance, you can register now as well. Okay, and it's better if you register now and seek the benefit of it. Once you complete your course, based on your certificate, based on your registration number, you can continue the process as well. In any case, consult with Dr. Mittal sir first. Those who have Dr. Mittal sir's number, consult with him first. Or if you don't have Mittal sir's number, you can WhatsApp me now. I will forward you his number as well as this registration link. So this link will be very beneficial for you because you may not know the nitty-gritty of a science-based practice. Nutrition and dietetics is also a science-based practice. In the future, you should not be misusing your own certificate. Okay, sometimes it happens. You may do some pharmaceutical management. You have to stick to nutraceutical. But if the line is very thin, okay, and if you jump into pharmaceutical management without having a MBBS degree or so, okay, that will cause you more harm. Okay, so having a legal advisory team helping you, guiding you with your business, okay, it's kind of an insurance that you're taking for your practice. Okay. In any doubt of registering right now or registering after completing the course, please contact Dr. Mittal sir, because based on not only for nutrition, okay, since this is the nutrition class that we are doing right now, so that's why I'm talking in terms of nutrition. But also, if you have any other practice, a lot of doctors here are BDS doctors, Ayurvedic doctors, homeopathic doctors. Okay, we have doctors here in this class from various backgrounds. Even for your own other practices apart from nutrition, you can use this link as well. Okay, is it clear to all? Legalwise.in. And for a new course that we have recently launched, this is the postgraduate diploma in nutrition and dietetics. Okay, you can the present students, if you are not doing fellowship do not have to upgrade to this. Other students who are just doing the basic diploma, you can upgrade to PG diploma if you wish. You just have to pay the remaining fee. Okay, fee structure and all, if you want what is the fees and everything, you can contact me, I'll give you the details. Okay, what additional benefit you are getting it, these classes will be there for you. Okay, you can also attend the Thursday classes. Right now, all the students who are attending nutrition and dietetics classes, you have nutrition, dietetics, and Wednesday classes. Okay, you can attend the Thursday classes as well, which I'm taking on child health nutrition. And also from July onwards, Dr. Mittal sir will take Sunday classes. On Sundays, Dr. Mittal sir will take holistic diet classes 2 p.m. to 4 p.m. Okay. He will give you worksheets to track your client's growth. Okay. You can start practicing based on your uh, family members as well. Consider your family members as your client. You can start with them. Okay. Worksheets will be given to you to track your family members' progress with a nutrition and diet plan that he has guided you to uh, function with. Okay. You can get a copyright holistic diet plan for Indian population. Okay, majority of you are going to practice in India, so for Indian population, or holistic diet plan with Indian cuisines, okay, in mind, it will be given a copyright holistic diet plan, which will not be used by any other academies, which cannot be used by any other nutrition or dietetics practitioners who have completed that course from other organizations. Okay, it's not for them. This copyright is only for NHCA students. Okay, learn food processing for Indian families. Okay, so that you de-influence yourself from a lot of processed food that you get from outside. Okay, when you do food processing at your own house, in your own kitchen, it is 10 times more healthier than the processed food that you get from outside, keeping in mind the convenience. Okay, those who have completed their graduation, they can pursue this. It's not that only you have to do your post graduation and only then you can do it. This is a 1 year duration course, 1 year. Books and these diet plans, copyrighted diet plans will be delivered to you. Fees, regarding the fees, I will, those who are interested, drop me a WhatsApp message. I'll give you the details regarding the fees. The additional benefit is that you're getting worksheets and tools to track nutrition and growth of your clients. And these diet plans that you get from this course will be copyrighted from practitioner, basic practitioner, from basic to practitioner level diet plans and diet sheets you will get. At least 10-step holistic diet plan making. This practical guidance will be given to you. Assessment tools are also given here. July onwards, the classes will start on Sundays. Till then, Monday, Tuesday, Wednesday, and Thursday classes you can attend. Monday, Tuesday, Wednesday, and Thursday classes you can attend. July onwards, Sunday classes will also be there. So 5 classes per week will be taken for you. Yes, exam will be there, same. After 6 months and 12 months, you can give the exam. The same pattern from home, online exam. Because you will be having 4 subjects here. Any subject which you are ready, you can give it after 6 months. The tough subject, whatever subject you think is tough or you need more time, you can give it after 12 months. So within 1 year, you can complete the course. Even the students whose exam is pending, who has not given the exam in the month of February, you can also upgrade to PG diploma. Okay. The classes that you are undergoing right now, your nutrition and dietetics classes, this exam you can give in August. And the remaining subjects that comes with a PG diploma, that you can give in next February. Okay. Any further details regarding the PG diploma, you can WhatsApp me regarding the subjects, regarding the fees. Thank you all. That's all for today.